take your questions. Today with us, we have the Deputy Secretary General of the Shanghai Municipal People's Government, Mr. Gu Honghui, from the Municipal Health Commission, Director Wu Jinglei, from the Municipal Civil Affairs Bureau, Director General Jiang Rui, and from Sun Yat-sen Hospital Infection Division Director Hu Bijie. First of all, Mr. Gu will brief us the latest news. Dear media friends, good morning. The citywide nucleic acid test, and as to the division of the sealed area, controlled area, and prevention area, I would love to give you some more information. Recently, we've held a citywide nucleic acid test. Until 8 o'clock, the 11th April, we have tested 25.12 million population, completing about 21.52 tests already, and 25,996 were abnormal. And we are also doing a confirmative test for the positive results in the first round. According to the Joint Prevention and Control Mechanism and Shanghai's actual condition, based on the division of the three areas, namely sealed area, controlled area, and prevention area, we are taking a differentiated management and preventative campaign. In the sealed area, it refers to the communities with the positive cases in the past 7 days, and we will have a 7-day contained management and 7 days of stay-at-home health observation. During the 7 day of contained management, this whole region will be contained, and they are not allowed to get out of their doorsteps, and all services will be received at their doorsteps. During these days, if there is no more positive case, then there will be 7 other days of stay-at-home health observation. And during that second 7 days, they are still not allowed to get out of their neighborhood, and no gathering of population is allowed. So for the 7 contained days and 7 observation days, if there are still no added confirmed positive case, then there will be another round of nucleic acid test of the controlled area. If still proved positive, then this area will be changed to prevention area. But if during those 14 days there are still some positive infected people, then that building accommodating that positive case will be contained as well. So there will be 14 days of contained management in that building. But as to the other buildings within that same community, there will be 7 days of observation, stay at home. Aside from that one building accommodating this infected person, for the other buildings, if we see the rising of other confirmed positive cases, then based on our epidemiological survey, there will be some other measures in place. That's about the sealed area. As to controlled area, that refers to the communities or public places with about 7 days of observation by staying at home. They're not allowed to have a gathering of population or out of the community. In principle, they should stay at home, and every day on the basis of self-protection, they will have a segregation of time periods in terms of accessing the life necessities in their neighborhood. During these stay-at-home days, if there is any positive case, this area will be changed to sealed area. In the 7 days of observation, if there is no more confirmed positive case, then in the 6th day of the observation period, all the people in this area will take a nucleic acid test. If all negative, this area will be changed to prevention area as well. For the sealed area and controlled area, if they are returned to any disease and are in need of medical services, then they are allowed to get out to access the medical help. For the prevention area, that refers to the villages or public places or entities with no positive case reported in the last 14 days. We will have a limitation of the gathering of population, and there must be minimized mobility of the population flow. And based on the situation in our city, the people living in the prevention area, in principle, should have some activity in their neighborhood, but they are not allowed to get out to enter into the controlled areas or the sealed areas. In the prevention area, if we discover any positive case, then this whole area will be elevated to sealed area. So please be mindful of the preventative measures and do not oppose the preventative measures, otherwise the whole community may be contained. Right now, based on our initial screening, different districts have already unveiled their list of the 3 areas. There are 7,624 sealed area and 2,460 controlled area and 7,565 prevention areas. After today's presser, the different districts will publish their respective lists of the 3 areas. And right now, the pandemic prevention and control in Shanghai is at a critical period. So in the next step, we will continue to implement different preventative measures so that we can forestall any outbreak of the positive cases, and for the 3 areas we will have a dynamic readjustment of them so as to minimize the impact over the people living in the 3 areas. We also are calling upon the support of all the civilians. Please be voluntary in shouldering the responsibility and sharing this task. We are aiming to build such a livable community so that we can work together to defend against the virus transmission. Thank you. Thank you, Director Gu. Next, let's give the floor to Mr. Wu Jinglei. Dear media friends, good morning. I would love to share with you about our prevention and control situation. There are about 917 local confirmed added cases and 25,173 asymptomatic carriers newly added in the last day, and 514 were found in the contained areas, and 300 were found in the risky population, and 47 were transferred from the previously mild cases and asymptomatic carriers. And 24,000 were found in the isolated areas, and 900 were found in the risky population among all the 25,173 asymptomatic carriers. And there are 531 males and 383 females among the newly added confirmed cases. And as to the districts, there are 291 in Songjiang, 212 in Pudong, 112 in Minhang, 71 in Minhang, 60 in Xuhui, 36 in Huangpu, 29 in Jing'an, 21 in Baoshan, 15 in Jingshan, 11 in Fengxian, 7 in Putuo, 6 in Hongkou, 5 in Changning, 1 in Qingpu. So, considering their clinical symptoms, the epidemiological survey, and the other testing results, those people were confirmed as the mild cases of COVID-19. For the 25,173 new asymptomatic carriers, their nucleic acid tests were positive. As to their details, please go to the official website. By 9 o'clock this morning, we have found 235,000 close contacts. 7,700 were already proved to be negative. The others are being tested again among the close contacts. 900 are in the isolation facilities. I would also love to share another piece of information. Yesterday, all the designated hospitals and the temporary hospitals have discharged some patients, and that number exceeded 3,000. They have returned to their residence for health observation. It is estimated that today, as to the number of patients being discharged from the hospitals, it will break a new record. So gradually there will be more people getting out of designated and temporary hospitals and returning to their normal lives. As Mr. Gu said, now we are at a critical moment, especially for us in the sections of reporting the result and sample taking and transference of the positive cases. There must be close coordination. We aim to minimize the time cost and improve the efficiencies and come out with the quick report. Once we discover a positive case, we will try to put them in medical help, and we will also increase the number of people recovering from this pandemic to be discharged. And we also highlight the combination of Western medicine and traditional Chinese medicine. We will take classified treatment plans for the patients, and in this process we must have orderly organization of those patients being isolated in the temporary hospitals. We would love to speed up this process of their accommodation in these temporary hospitals. And upon recovery, we must do a smooth work in terms of discharging them from either designated hospitals or temporary hospitals. In their transportation from the hospitals to their residence, there must be efficient coordination so that these people could get back home safely and soundly. Thank you, Mr. Wu. Now we open the floors to questions. Please identify yourself before raising the question. Now the floor is open. From line number 1. Thank you. From People's Daily, my question is to Mr. Gu. Ever since the classification of the 3 areas, for the controlled area and prevention areas, the civilians and residents can get out of their doorsteps. So will there be any reminders for those civilians living in these 2 areas? Thank you for the question. For the residents in the controlled areas, they can get out of their doorstep, and for the people in the prevention areas, they can get out of their community. But right now, since we are having a high rocketing number of positive cases in the city, so we must stay vigilant. Do not drop your vigilance and try to avoid gathering a population. We champion the idea of working at home and do not go out. If you do need to go out, we recommend you not to get out of your township or your community. And if you do get out, please wear facial masks, take social distance, and the self-protection measures must be carried out. And let's work together to curb the transmission of the virus. Next question. From line number 3. From Xinhua News Agency, yesterday it was mentioned that for the people discharged from the medical observation and the hospitals, they shouldn't be forbidden to go back home. So how to solve this problem, and what are the better plans to help them out? Madam Jiang Rui. Thank you for the question. That is indeed a very important question. Just now and yesterday we have reported the number of patients discharged from the temporary and designated hospitals. They stand in a large number, and with the considerate care of the medics, they are finally discharged and are able to get back home. That is relieving. And to ensure that those people could smoothly get back to their community, and conduct a normal life afterwards, we highlight the following pointers. First of all, the discharged patients and the people out of their medical observation, the different districts shall transport them from one point to another in a closed loop. So the districts must have a special team in place to transport this group of people. The medical institutions, including the temporary hospitals, must provide instant information for the transportation, and also they must be informed about the village committee, the property management entities, so that those different entities will not reject the returning patients. And also, there must be 7 days of stay-at-home medical observation for those discharged people. We recommend that those people with conditions should live in a single room and eat at a different time periods with the others, and try to avoid close contacts with your family members living together. And we also highlight that different neighborhood committees and village committees must organize some volunteers to take an active role in caring for those people coming back home, especially for the left alone elderly people, the disabled, and the other vulnerable groups. There must be a guarantee of supplies and the caring for them so as to solve their problems in lives instantly. In addition, there are still a large number of people out of medical observation or out of the hospitals who didn't live in the communities beforehand. For example, the migrant workers, the people working in the food market, and the others who live in the dormitories. So for those group of people, we recommend the different village committees and neighborhood committees to coordinate together so that those people could return back to their posts as before. And the precondition is there are still 7 days of observation. For the migrant workers, they must be provided with 3 meals a day and some life necessities and supplies. For their employment workplaces, because of containment or the other reasons, if they cannot return for a residence, we recommend the local neighborhood and village committees to organize such a residential area. Thank you. Next question. From line number 24. From 21st Century Economics, my question to the experts is, those people discharged from the hospitals and observation period, are they risky anyway? I know that's quite a concern in the hearts of many people, because in the coming time, we will witness thousands or even tens of thousands recovering patients from the pandemic to return back home or to their community. They may be your neighbors one day. As to the buildings or the communities accommodating those recovering patients, will they suffer? 2 years ago, the medical circle has already risen up to that question. Will there be a rebound of infection? And will those discharged people be infectious? There have been some researches, and according to the survey, overseas we have seen some repeated infection of those recovered patients. So people are naturally worried about it. But in effect, we discovered that those repeated cases actually haven't infected the other people. So the technicians and the scientists have done some survey about those people. For example, through the nasal or oral test, they have cultured the virus, and they haven't found any positive virus from them. And secondly, for their samples, they have done a gene sequencing and they failed to find such a gene sequencing. So, professionally speaking, those repeated positive cases are just partial segments of this virus, which means they're dead virus. The virus in their bodies is dead, so they're not infectious. And we have consistent study results in China and abroad. We have proved repeatedly that those discharged patients are not infectious. And in version number 9, COVID-19 treatment and diagnostic plan, compared to version number 8 of it, some articles and items are more scientific. For example, for those discharged people, the criteria of discharge has been readjusted to the fact that the O gene and N gene through 2 nucleic tests should be above 35. If they meet the criteria, they can be discharged. But in version number 8, that value was set as 40. So that means we can shorten the time of hospitalization since we release the criteria. And after their discharge, there must be 14 days of isolated management and medical observation according to version number 8. But now it is recommended that ever since they discharge, there should be only the health observation period. In version 8, since discharge, there should be another round of counseling after 2 weeks of their discharge. Now it's cancelled. We hope to allow those people to get back to their normal work and life as quickly as possible. So in version 9, we have shortened the time of hospitalization, and since discharge, they are only required to have 7 days of observation, and the repeated counseling to the hospital is cancelled based on a large number of clinical data and studies. So we believe those people are safe. Of course, the 7 days stay-at-home observation are still necessary, and they should live in a single room with good ventilation, and they should keep some distance from their family members living together, and they must wash their hands and eat at a different time period from others. Next question. Line 8. Thank you. From the Phoenix TV. My question is, ever since the classification of the 3 areas, there will be more population flow. For example, the guards and the cleaning ladies, they may have contact with the other people in the society. So how to step up our measures of pandemic prevention and control? Mr. Gu Honghui, please. Speaking of the service people like the cleaning ladies and the delivery men, those people are making sacrifices for the operation of the city, so we must care for those group of people, and we must have some insurance measures to protect those people, both from the parts of the enterprises and the communities and the individuals. For the employers, they must have a antigen test in the morning, a nucleic acid test of those staff members in the afternoon. So 2 tests every day. And they must offer frequent training for those personnel, for example, their health status and sufficient supply of self-protective items to be offered to their staff members. And for the communities, just to keep the door safe. In this community, if you have accommodated a positive case in the past 7 days, then we're not encouraging those people to work as the service people. If you don't have such a positive case living in your community, then considering the need of the city, those people living in the community, once acquiring their identity card and their certificate offered by the entity, and the negative nucleic acid test result in the last 48 hours, can apply for the post as a serviceman. And they also need to continue the 2 tests per day. If they prove themselves to be negative through 2 tests per day, they can come back to their post to guarantee the supply of necessities for the city. And individually speaking, they must take some protective measures like wearing gloves while delivering items and wearing facial masks. I know the days are getting warmer and it's quite suffocating to wear the facial masks all day long, but in consideration of the safety of themselves and all the others, please be committed to those measures. Thank you. Next question, please. Line number 17.
谢谢主持人，我是澎湃新闻的记者。我想问一下巫主任，目前感染的人数还是比较多的，方舱医院在
Thank you. From the paper. My question is to Mr. Wu. I know that those temporary hospitals are still receiving a lot of patients. So what are the management requirements in those hospitals to better manage such a large number of patients? You may have noticed that the reported number of infected people in the temporary hospitals stand in a large number, and we have been building the temporary hospitals in the city and in different districts in order to receive those patients. And those temporary hospitals are mainly receiving mild cases and asymptomatic carriers. And as to those people suffering from severe symptoms, they should be isolated in a centralized way. And right now, we are receiving such a rising number of asymptomatic carriers every day. So the painstaking point for us is, first of all, how to receive them. And secondly, we must pay close attention to how many of those received patients can be transferred to designated hospitals. And also, another difficult point is temporary hospitals are different from traditional hospitals. So we must do some tours in the hospitals and also to check the conditions of the patients regularly. And also we need to consider how to discharge the patients once they recover. First of all, in terms of receiving, we have a centralized coordination in the city. These people will be firstly received, and once they settle, we will do a classification of the patients for centralized coordination in the city level, and there will be dedicated vehicles to transport those people to the temporary hospitals. And secondly, as to the classification and the transferring of some patients. Once admitted to the temporary hospitals, some people inform you that I have some basic and mild diseases and they're not infected yet. So once we discover those special cases, we will do classification work and then transport them elsewhere. We will guarantee standardized diagnosis and treatment and classification among all the temporary hospitals. So it must be consistent among all the hospitals, and we must pay close attention to any change of those patients. I noticed that there is another key functionality of the temporary hospitals, that is to observe any change of the patients. Especially, we must realize if there is high risky points for those received patients. If they do have the risky point, they should be transported to the designated hospitals. Or if their disease progresses to, for example, heavy symptoms, they must be transported to the designated hospitals as well. And secondly, as I said, the temporary hospitals is big in size, different from traditional hospitals. We must have a zoning system in terms of management. For the medical staff, they must take tours to discover any potential problems on those patients. Of course, in the temporary hospitals, there will be the regular nucleic acid testing arrangement and some other management issues in terms of discharge of those patients. And the fifth stage is about discharge, because discharging those patients is one efficient way to distribute our medical resources. We hope that those recovering patients can get back to their normal lives as early as possible, and we're doing this task according to the national requirement. We will strictly implement the measures of discharging the patients from the temporary hospitals according to the national requirements. Once they meet the standard, we will instantly connect with their neighborhood community so that there will be smooth transportation back home. According to the data in the past several days, the number of people being discharged from the temporary hospitals is rising up quickly. So another task upon us is to coordinate with the communities so that these people can get back to their residential houses safely. So those are the paramount stages we must pay attention as to the temporary hospitals. The last one question is allowed. Line number 19.
谢谢发言人，我是青年报的记者。我的问题是，刚刚提到的无疫小区需要符合什么样的要求？如何创建？怎么申请呢？谢谢。
My question is about the communities. How to set up those communities? How to manage them with no COVID-19? Since March, the different communities have given full play to their grassroots level. Civilians living in the communities and different social forces participated in the fight against the pandemic, and we work with one mind. So against that backdrop, according to the national requirement, we are launching a new campaign themed under building communities with no pandemic at all. The goal is to promote different communities under the leadership of the grassroots level CPC Central Committee to mobilize the role of the civilians in order to improve the efficiency and effectiveness of the pandemic control in the communities. In the past 14 days, with no positive case in the community and all the nucleic acid tests on the 13th day are negative, then those communities can be defined as the communities with no pandemic. And we must do the following work. For example, standardizing the access control, standardizing the health observation, self-protection, delivery service management, disinfection, and waste disposal, and enhance information sharing, service guarantee, and warehousing of supplies. There are detailed requirements as to the above-mentioned requirements, and as to the application, they can take voluntary work in application, and once the time is mature, this application will be reported, and the neighborhood committee will do the application work. Once reviewed and approved, this case will be filed in the community level, and they will be reported and published to the public. Once identified as the clear neighborhood with no case at all, and see a rebound of a case, we can do another round of review. So we hope everyone could contribute to the fight against the pandemic. We hope there will be more such zero-case communities. Thank you. That's the end of today's Q&A session. If you have any other questions or need of interview, please come to the Municipal Level Health Commission or the Municipal People's Government in Shanghai, and we will publish the updates immediately afterwards. Thank you for watching.